Our topic is obsessive compulsive disorder. Obsessive compulsive disorder, or OCD, is a mental health disorder that affects people of all ages and all walks of life. It is a common, chronic, and long lasting disorder in which a person has obsessions and compulsions. Obsessions are uncontrollable, unwanted, recurring intrusive thoughts, images, or urges that trigger intensely distressing feelings, and compulsions are repetitive behaviors an individual engages in to attempt to alleviate or neutralize the obsessions and or decrease the stress. Here are the most commonly described obsessions and compulsions of this disorder. Contamination obsessions, fear of coming in contact of contaminated substances or things. People with this obsession would go to such lengths of wearing gloves just to keep their hands safe or away from the things they consider dirty. It is a little similar to the way we acted during the pandemic to prevent getting infected by the virus, which results to washing and cleaning, which is a type of compulsion where the sufferer would excessively wash their hands and clean household items. I once came across this topic before, and it was said that washing your hands more than 10 or 15 times a day is what we consider excessive. Examples of excessive cleaning is washing their shoes, credit cards, cell phones, and other things that may have come in contact with these things as they are considered to be contaminated or dirty. We commonly mistaken this symptom as germaphobe, but how to differentiate this OCD and germaphobe? Germaphobe clean to reduce germs, while OCD cleans to reduce their anxiety. Violent obsessions, fear of acting on impulse to cause harm or committing violent acts. This includes thoughts about hitting, stabbing, strangling, mutilating, or injuring their family or a stranger's pets, including themselves. Sexual obsessions, fear of sexual behaviors, having intrusive thoughts or images about distressing sexual acts with undesirable entities, children's or animals. Examples includes recurring fear or worries about having different sexual orientation, repetitive thoughts, or touching someone inappropriately. Violent and sexual obsessions usually leads to mental compulsions. Mentally reviewing events to prevent harm, praying to prevent harm, and counting and canceling. This includes mentally reviewing lists, evaluating and suppressing your own thoughts, trying to convert bad thoughts into good ones, self reassurance, and mental undoing. Next, we have responsibility obsessions, which is the fear of being held accountable of an accident or recklessness. In this case, the sufferer is less concerned about their own safety and more concerned about their actions or non actions. They are scared to be blamed or to be held accountable or responsible for things they didn't do. Usually, this is a normal thought for everyone, but in this case, people with this type of OCD suffers with anxiety of possibilities that could lead to accidents. This usually leads to compulsive checking, which is having the need to check or making sure that everything was done correctly, or not forgetting anything and or that nothing wrong is going to happen. This includes feelings of getting anxious if you lock the doors or windows when you leave your house, or if you turned off the stove or other appliances. And this also includes the thought of, did you lock your car whenever you leave your car in a parking lot, by the mall, or everywhere. Last, we have perfectionism related obsessions, overwhelming fear of making mistakes. Examples may include having doubts if you are doing things correctly. People with this OCD usually fears judgment and disapproval from others. This could be due to having parents with unrealistic high expectations, and this often leads to orderliness, which is putting things in order, which could be by color, size, or alphabetically. As though stress is a normal part of life, Experiencing it for a too long period of time could cause different levels of anxiety and feel on edge, thus triggering OCD symptoms. Traumatic experiences. Trauma is an emotional response to a very upsetting event. This could be events that resulted to hospitalization, natural disasters, death of a loved one, or even an abusive relationship. And while triggers of OCD usually involves negative experiences, even positive or exciting events can trigger symptoms. For example, major life changes like moving to a new home, having a new job, or becoming a parent, which is very scary. And next we have sleep disturbances. A good example could be insomnia or frequent nightmares, which could affect the sufferer's mental health. And last, we have obsession triggers, which are things that reminds them of their common obsessions, like seeing a dirty room or seeing an object that could cause harm. Treatment or coping strategies. We have two types of psychotherapy. One is exposure and responsive prevention, or ERP, which is a type of cognitive behavior therapy, or CBT, where you are guided by a therapist while practicing confronting thoughts, images, objects, and situations that make you anxious or provoke your obsessions. This is the exposure components of the therapy. And the response prevention is making a choice not to do a compulsive behavior when obsessions are triggered. Next, we have acceptance and committed therapy, or ACT or ACT. While this treatment is showing promising results in potentially reducing OCD symptoms, they are not concretely proven to do so, and it is still undergoing research. And for medications, we have selective serotonin reuptake inhibitors, or SSRIs, which are antidepressants that increases serotonin in the brain to help regulate mood. And that brings us to the end of my presentation. Thank you so much for your time and attention, and I hope you have a great day.